Okay, so greater the asset angle, the greater force absorption. Shorter the angle, not as much. Cervical can't support as much as lumbar. Really sorry, I wasn't recording. Apex flight, a 10-kilogram medicine ball is 3 meters off the ground, so it has 3 meters to fall back to the earth, hint, hint, potential energy, and has a horizontal velocity of 10 meters per second. What is the total amount of energy this object has? It's literally going to be the total energy equals the potential energy plus the kinetic energy. So you've got the potential energy of 10 kilograms multiplied by 9.81 for gravity, multiplied by 3. And then once you figure out that number, add the kinetic energy, which is 1/2 of the mass. So 10 times velocity squared, which is 10 meters squared. And altogether, boom. It's okay, it's okay. So when in doubt, it's asking for energy. And so remember the 3 different types of energy that an object can have that we've talked about so far. There is also chemical energy, but we're not dealing with that too much in this class. That's something we bring up in exercise physiology when we talk about calories. So you got potential energy, kinetic energy. All right, Braden, we will get to yours in one moment because that one is definitely more complex, as is Luke Batten's. So let's go ahead and get that whiteboard up. So make sure I've got everything set to where I can see what's going on. All right, so we've got an arm, we've got a bicep that's gonna be lifting upwards. We know that this right here is going to be 86 degrees. So what we're then going to have, we're going to have the vertical force. It's going to be multiplied by our insertion, which is going to be 0.025 meters equals, and we're going to have 2 different things we're going to have to sum up. So we've got a 20 kg weight multiplied by 9.81, because we've got gravity there, multiplied by 0.25 meters, because 25 centimeters. Then plus open an arm that weighs 5 kilograms times 9.81 gravity times our center of mass, which is 0.125 meters. So that's going to give us our vertical force. Wow, that's ugly. And then we need to actually solve for the hypotenuse. So we're going to take effectively the sine of 86 degrees equals the vert force over the bicep force. And so once we factor that, we're then going to have our bicep force equals our vert force divided by the sine of 86 degrees. All right, so that takes care of Luke. Now Braden's. We have an object. It's going to go ahead and figure out the angle it was fired at. If it hits the ground, a grand total of 50 meters away in 2 seconds. So what that means is we need to solve for the vertical velocity and the horizontal velocity. And the horizontal velocity is going to be 25 meters per second because we literally just have to divide 50 meters divided by 2 seconds. It's the vertical that's going to be a little bit more interesting because for that, remember guys, our displacement equals our V sub O times T, and then in this case, it's going to be minus 1/2 of 9.81 times time squared. Now, in this example, because it starts at 0 and ends at 0. So we have 0 equals our initial velocity, which we don't know, times time, because we know it was in the air for 2 seconds, minus 1/2 of 9.81, which is going to give us, what's it going to be, 4.905 times time squared, so that's going to be 4. So once we go ahead and factor this out, we're going to then have V sub O times 2 equals 4.905 times 4, which is going to give us 19.62. So then, if we divide both those sides by 2, we have V sub O equals 9.1. So then the next thing we need to solve for is the angle. And so for this, we have the tan of the angle is going to equal the opposite, which is going to be our vertical. So that's going to be 9.81 divided by our adjacent, which is going to be 25. And so that's going to allow you to figure out the angle that it happens to be at. So last but not least, Catherine's next question, which is how much force do you need to create to move a block with a static friction of 0.9 and a dynamic of 0.8 if it weighs 8,000 newtons. So we're trying to move this block. The static friction is going to be 0.9. The dynamic is going to be 0.8. Which of these two should we use in this example, guys? Bingo, because it's to move a block, not to keep it moving. So literally, our force is simply going to equal 0.9 times 8,000 Newton. Good job, Luke. Any other questions or things you guys would like to go and review on? No worries, guys. Take your time. Be right back. I need to go turn on the metabolic card. I'll be right back. Yeah, the minimal math is literally, there's really no math to it. It's just going to be working through the major concepts. So that's one that's going to be hopefully a lot easier and a lot faster for you guys to go through. Angular momentum of an object that happens to be spinning at 90 degrees per second with a radius of 2 meters and weighs 50 kilograms. So remember, guys, really all we're looking at here, guys, is going to be our angular momentum formula. And so that is going to be equal to our angular momentum, h, equals the mass of the object multiplied by the radius squared multiplied by its rotational velocity. So in the example that Catherine put up there, we have our h equals 50 times 2 squared, so that's going to be 4, times 90 degrees. So 200, so times 90, so it should be Any other questions you guys want to work on? So you just draw a pizza. All right. So loose question, how does the inertia of the limb change if the weight is 10 kilograms and the radius of gyration goes from 1 to 0.5? And yes, Luke, it is the inertia formula. So we're going from the radius of gyration being at, say, 1 meter weight to now it's only going to be at 0.5. Ooh, man, a wonderful rain and everything is messing with my sinuses. That's a 5, and I promise I've drawn one before, and they've been just as ugly. So, what were, sorry, 0.5. Make sure it's big 0.5. So, our inertia is going to be equal to our mass times the radius squared. So, we're going from a grand total of 10 times 1 squared to 10 times 0.5 squared. So that means we literally had initial inertia Yeah, no worries, Luke. Anything else you guys want to go and review? All right. Yes, we have done this one, Catherine. We've done it from both directions. So the idea with the linear strain of it slowly increasing with time is you're just going to see this type of relationship. So that's going to be, we go over here. Oh, Jesus. So this is going to be the total force, and this would be the compression. So figure at 0% compression, you have 0 newtons of force. At 5% compression, you have 500 newtons of force. So if it's following a straight line, that means at 20% compression, we're naturally going to have 2,000 newtons of force. So in theory, when we get all the way up to 100% compression, that thing as tight as we can get it, it's going to require a grand total of 10,000 newtons of force. Any other questions you guys would like to review for the exam? Awesome, guys. Well then, gone this far, so we might as well go further. Let's go ahead and lecture. So let's go ahead and talk about our wonderful lower extremity. Now, first thing that we've got when we're going through the lower extremity is straight up the hip. Hip is a ball and socket joint, and unlike our wonderful shoulder joint, is a way deeper socket, which is going to give us a lot more stability. So the head of the femur is going to be inside of what's known as the acetabulum, and this is what's going to keep us in position. And it turns out we are going to produce a whole lot more force throughout our hip. Now, a link I've got here at the bottom, if you're interested in, it'll actually show you some differences in how people's hips are literally effectively aligned. And then also we're going to talk a bit about femoral neck angle and some other components that are going to literally influence the natural amount of flexibility you're going to have at your hips. Now, the cartilage of that acetabulum is going to be thicker around the outside, further pocketing it inside. And then there's hydrostatic pressure, which in turn is going to keep that area lubricated and help keep it in the socket. So we then have a number of ligaments that are crisscrossing around that are keeping that hip joint in the socket. So if we're looking from the posterior, we've got our iliofemoral ligament and our ischiofemoral ligament. It's just literally where it starts from, is whether it's from the ischium of the hip or from the iliac. And then we have the other side of the iliofemoral ligament, that's the Y, that's in the anterior, and our pubofemoral ligament, aka the pubic bone. Now, all of this is going to keep or help keep that hip in the socket. Now, this is going to help twist it into position, especially when we're talking about extension, so being or standing up completely. And then we have a number of bursts. And bursts are going to be essentially fluid-filled sacs. They're going to work essentially as a cushion to help to allow for these functioning of movements and hopefully decreasing our pain. So we've got our bursa on the bottom of our hip, aka the hip bone we're sitting down. We then have our gluteus medius bursa. So it's going to be right past the tendinous insertion of the gluteus medius itself, which is really important for abduction of the hip. And then our trochanteric bursa, which is literally the greater trochanter at the top of the femur. And then our iliopsoas bursa, having to be more on the inside. Now the bone directly below our pelvis is going to be our femur. This is the longest and should be strongest bone in the body. Now the weakest point is the femoral neck. So we have the trochanter, and then we have the neck coming off to the side. This is made of trabecular bone, not cortical bone, which is the much stronger type of bone. We'll get to that more in the later chapters. And it's smaller in diameter. So if there's going to be any failure part, it's going to be the femoral neck right here. Now, the hip itself is actually made up of two iliac, okay, which are on the side of the hip. We have our sacrum in the back. Then we have our ischium underneath, and we have our pubic bone right in front, so giving us our pubic symphysis. Now, when it comes to the ilium, the ischium, and the pubic bones, they effectively all three are fused together. We do have the sacrum in between, so that gives us what's known as our sacroiliac joint, our SI. And then we have our pubic symphysis, which is another cartilaginous meeting of these two bones. Now, notice, guys, these are two pelvises of humans, but you can see the differences in the alignment of the hip sockets, which are naturally going to convey differences in mobility, preference of squat, stance, knee angle, and otherwise when people are going and doing different exercises. Now, our femur itself are going to effectively be influenced by the movement of the hip. So pelvic tilt direction. Okay, so everybody go ahead and stand on up. If you put your hands on your hips, okay, you're going to think anterior pelvic tilt is tipping our hips forward. posterior pelvic tilt is going to be tilting our hips back. Now because I have tight hip flexors, am pulled a little bit in an anterior pelvic tilt, so I have to actively work on trying to keep myself from being bent forward while I happen to be lifting. Now, lateral is whenever we're kicking our hips to the side, and we're going to call that what's known as abduction, and how we're going to be moving the femur. So notice whenever I was in that posterior position, we're naturally helping ourselves move a little bit more into flexion. So that's lifting the knee up. So leaning back naturally wants to help pick up your legs. Anterior is helping extend the hips by obviously helping push them behind you as you lean forward. Now, obviously, different movements in sport, you're going to have extension while you're trying to get essentially posterior tilt when you're doing something like jumping. And then you're going to have anterior movement when you're in flexion, when you're doing something like sit-ups. Now, hip flexion, which is going to be lifting our knee up, is mostly done by our iliacus and our psoas major. Now, from there, we have our pectineus, which is giving a smaller amount, our rectus femoris, which is the center muscle of our quadricep, our sartorius, which is sometimes known as the cobbler muscle. It's the muscle that kind of runs laterally through the thigh, and then our tensor fasciae latae, TFL, which is going to be the muscle on the outside of the hip flexor. So the major four hip flexors: iliacus, psoas, rectus femoris, and TFL. So your iliacus and psoas are going to be running through essentially your low back and your hips, helping to go ahead and lift your knee up. Whereas your TFL, you'll feel that ball right on the outside, that's your TFL, and then your rectus femoris is that center and most superficial of all of your quadricep muscles, which makes it fascinating because it crosses two joints. So now we have images of how that iliacus and psoas. Now the psoas, think of biomechanics and think about forces. Whenever this psoas fires, obviously it's trying to pull both its origin and insertion together. So what type of force is it naturally going to create on the low back whenever you're firing your psoas? Yes, Luke, shearing, because it's going to be pulling their vertebrae anteriorly. So it's actually going to be causing a shearing force in the low back. So that's why some of the arguments about not doing things like straight leg sit-ups to effectively try to avoid putting that shearing stress in the low back is sometimes advised, though it's not going to be anywhere near as important as just making sure you've got good spinal health and really good length. Because you imagine if this hip flexor is short, it's constantly producing that shearing stress on your low back all day long. And so that's why having flexible hip flexors is a good thing. But it turns out, like I'm doing right now, sitting down, good old chair jail is a great way to keep causing your hip flexors to shorten more with time, so they're not going to function like they're supposed to. So that's that sartorius when we talk about how it's going to cross both sides when it comes to hip flexion, inserting into your tibia, but then going through your iliac crest. Now, hip extension, the big money maker here is that glute max. It should be the biggest and thickest muscle on the human body. The only muscle that's close to it in size and effectively girth, what you should find would be your lats. Now, the other muscles that are going to help are going to be our semitendinous and semimembranous, and then our biceps femoris, specifically only the long head of the bicep femoris. All of those are going to be inserting or origin of our ischial tuberosity and then inserting into our tibia or fibula. That's going to be causing not just hip extension, but also knee flexion, as we'll learn later on. But the major one is going to be our glute max. So One thing that's important to understand is you're really typically only using your glute max when you're doing things that are, when I like to colloquially refer to them as awesome. Now, you'll go to the rec center and you'll see the people with the bands around their knees and doing, you know, light lifting and doing hip thrust all day long because they're trying to increase the size of their gluteus maximus for typically more of aesthetic reasons. But the way to really build it is by honestly doing heavy compound movements like squatting, deadlifting, and lunging, step ups, etc. Romanian deadlifts maybe to a lesser extent. And then additionally, doing things like sprinting. Your glutes are there to get work done whenever you've really got to go at a high output. So since most people spend all day sitting on their glutes, which is literally laminating them, think like laminated paper, causing them to function not as well as they did before, along with they rarely have to push themselves, they can effectively have what's referred to as gluteal amnesia. They have literally forgotten how to use their butt, which is pretty obvious. I mean, if you walk around your average store and you see people in profile from behind, you don't see a lot of people with really developed glutes. And that's simply because it's a muscle that requires you to get after it to really get it to turn on. And a lot of people live a life that they don't ever have to really get after it, which is in and of itself its own, nice thing, because you don't have to feel like you're fighting to survive at all times. So now, aside from extension, thank you, Luke, you are going to have a Bduction, and that's going to be lifting your leg out to the side. This is done mostly by the glute medius, but it's additionally being helped by the glute minimus directly underneath it. Now, glute minimus is also going to help with rotation of the hip, and we'll get to that in a little bit. So this is how we're going to help get our leg to move laterally. Now, why do we want to be able to move our abduct our hip or abduct our femur? Why do you guys think that would be? Okay. This is abduction. So this is going to be going and lifting our leg out to the side. Think dog peeing. What about? Actually, yes, that is going to be important for avoiding hip drops. So you're going to walk correctly. And then also being able to move laterally. So we can push off to the side and we can get our feet out wide to catch ourselves if we're falling and slipping. So by the firing of that glute medius, we're actively going to lift our hip. So we're going to be able to walk effectively with a more natural gait. So every time you're going to go ahead and step, if I'm standing on one leg, if my glute med doesn't fire, my hip's going to drop. And so it's going to be that much easier to bounce my foot off the ground because I'm not able to stabilize my hip and it's just dropping, as opposed to keeping itself in correct position. Now, we then have adduction. So that's pulling our legs together, which is being done by our adductor magnus, longus, brevis, and gracilis. All of those are very important in getting effectively our ability to pull our legs together. Pectineus is going to help a little bit to a lesser extent. It's nowhere near as big of an issue. But another thing to keep in mind, guys, is these adductors are going to help a little bit with also extension. And then, guys, here's a good picture of the TFL on the outside, as well as the ilius and the psoas. Now, how many of you guys, after doing some heavy squatting, had some incredible soreness in your adductors the following day? And that's because they're not only helping stabilize our body, but that's going to be also a big component of helping a little bit with the extension of the hip. Now, notice, guys, these are also going to be important for keeping our legs underneath us in the swing phase, so when our leg is coming through and we're walking. So we're naturally always having some adductor and abductor function, literally when we're just walking forward, to keep our legs from bouncing off each other and also make sure that we keep our pelvis in correct position. Now, let's talk about some things that you probably never wanted to talk about ever before. The muscles of the pelvic floor. You have a number of muscles that are obviously there to make sure that you keep all of your organs where they're supposed to be. Now, obviously, you can guess what each of those components are for. Now, here's the big thing to keep in mind, guys. These muscles, like any other, need to have a certain amount of strength and tone. It is never normal to pee yourself when you laugh, when you jump on a trampoline, anything along those lines. That is literally showing a failure and a lack of tone in the musculature of your pelvic floor. Now, don't get me wrong, they can obviously go through trauma, specifically when you think about something like childbirth, but these muscles need to be strengthened because effectively, if you think of your body, your diaphragm is the upper limit for effectively all of your internal organs underneath it. You then have your obliques, rectus abdominis, transverse abdominis, all those. And then underneath, you've got your pelvic floor muscles that are literally keeping every part of your GI and everything from falling through. So you also shouldn't be having issues with incontinence, which our culture has made it relatively not normalized, but a lot more normal with, oh, it's okay, you just have to wear Depends or anything. Like, no, it's not okay. This is an issue with lack of muscle function. And this is literally something that certain physical therapists specialize in, which is pelvic floor therapy. In fact, one of my friends, their wife, because she's had such issues for so long, was literally looking at getting reconstructive surgery to her pelvic floor, which was going to cost, I believe it was something like $12,000 to do. And the outcomes for it are not that great. Instead, she started going to PT, and now she has already improved function. She's not having issues with incontinence. She is living has a much higher quality of life. So that was from the inside down. Now from the outside up, you can see that same thing. If we have our pubicogenesis, iliococogenesis, and then our cocogenesis, which are all. So that's an interesting one there, Zach. How many of you guys are familiar with the term kegels? Never heard of it. Okay. So kegels, effectively, guys, are actively trying to contract the muscles of your pelvic floor. So you're literally trying to contract. So like, guys, think about, right now you can go and practice it wherever you're at. Trying to contract all the muscles of your pelvic floor like you're trying to stop yourself from peeing once you started peeing. Does that make sense? You're really trying to like contract all the muscles of your pelvic floor. Now there's ways you can just contract on the urethral side. There's ways you can contract more towards the posterior side. We'll leave it at that so I can avoid using other terms since I am recording this. But you can actually feel how you can get those muscles to tense and relax. So the idea is you're learning how to tense and relax those muscles as a way, just like if you were to try to strengthen your hands by using a gripper throughout the day to help just learn how to get your hand to contract hard and relax. So it's going to go ahead and work appropriately. And you can go too far on the other end, which is you can strengthen these muscles so much that you make certain things far more difficult to do than otherwise would have been. However, my little pro tip for you guys today, obviously during COVID, you don't have to worry about sharing equipment so much with people, but when you want to have your space and they ask if they can work in, you say, yeah, go for it. I'm just supersetting. And then just stand there and then they'd be like, what are you doing? Oh, I'm supersetting with kegels. And like, keep like wincing your face as you're making hard eye contact with them. It's a good way to make sure you always get your own space. Thank you, Zach. Now, our lateral rotators are going to be the ones that are going to be turning our feet out if you think about facing forward. And or if you're thinking about trying to like use a hacky sack or something and trying to kick the ball with your instep by lifting your foot up. Thank you, Luke. So these are going to go ahead and rotate us appropriately as we're rotating through the pelvis. Now, these are also important with aligning the knees whenever we're doing certain lateral movements. And that's where we're going to have things. The piriform is probably one that you guys have all heard of. And since it can obviously get tight from running and other repetitive actions, we have our superior and inferior gemellus and our quadratus femoris and our obturator internus that are all going to work on rotating that femur laterally. Now, the medial rotator is really your glute minimus. Now, this is getting some assistance from our TFL, our medial muscles of our hamstrings, and a little bit of glute medius. Now, these are only 1/3 the strength of what you're going to find from those lateral rotators. And so that would be trying to turn your foot out to the side, which naturally is going to be a movement that's something you typically aren't going to have as much strength in, and that's normal. Now, abduction is going to be when we're literally just sitting down, like right now, and you think push your knees out. This is going to be done by our hip flexors, specifically our TFL, and you can feel that really ball up, and our hip abductors that we've talked about before, aka mostly your glute med. Now, adduction is going to be done by our psoas and iliacus and our adductors. And the reason the posterior ones are going to be more effective is because there's a greater stretch when you happen to be in those flex positions. AKA, your adductors are going to be more powerful when you happen to be in that horizontal position and vice versa. Now, before we go further on this, one thing to keep in mind, guys, is when you're doing training, what's going to be the major response that your muscles really have from training? Like, what's really going to happen to them? If you're lifting weights, what's the typical response the body has from resistance training? Good. Not just get stronger, but what else do muscles do? Get bigger. Thank you, John. Now, herein lies the problem, and you have to think about the biomechanics of what you're doing. How many folks do you see that do a lot of work on the hip adductor and hip abductor machines at the gym? Most of the people you see on that machine where you're seated, you're trying to pull your knees together. What are they trying to do? What would you say is their actual intent for being on the machine in the first place? Anybody? Hello? Give you guys a moment because I've got to blow my nose. It's been on since like something. Go for it, buddy. You got plenty of options for it. There you go. They're typically, now that would be true when they're doing the hip abduction. The problem with the hip adduction is what's really the only response any muscle has from training? Adapt to meet demands, and specifically get bigger. So a lot of the folks that are doing hip adductor work on the machines of the rec, all they're doing is actually helping make the muscles of their adductors bigger. They're literally hypertrophying their adductors, which in turn is making the inside of their thighs bigger. Do you think that's really the goal a lot of those folks have? So therein lies the issue, which is a lot of folks aren't thinking through what's really going on with the training. It's like doing a lot of oblique work. Doing a lot of oblique work is in turn going to make your obliques over a long enough period of time literally thicker. They're going to be bigger. It's going to make your waist blockier. And that's another thing that people probably aren't striving to try and do. Instead, they're probably trying to get would be what they would determine probably to be a more aesthetically pleasing lower body than it is for them to have, you know, big, thick, meaty inner thighs, which if that's what they want, go for it. You do you and you get after it. But just coming from someone that does actually have larger adductors and thighs in general, it gets to be really annoying and frustrating whenever your thighs effectively eat pants professionally. The frequency I have to buy new equipment or buy new jeans and specifically khakis and work pants, it's a little frustrating. And how? Absolutely, Zach and Luke, it's already on there. But the problem is people aren't thinking in that way. They're thinking, oh, I'm going to train this muscle and it's going to get toned, which tone in their mind is that somehow it's going to be the exact size and property they're looking for, as opposed to if you train the muscle, it's at minimum going to stay the same size. Most likely, if you attack it with a certain amount of intensity and enthusiasm, you're going to increase the size of that muscle. And that's the thing is most people aren't thinking through that. Instead, they're thinking, if I exercise that muscle, I'm going to have what's known as spot reduction, which is a myth, which is where by exercising, you're going to decrease the amount of fat in that specific area, which in turn is going to make that area a little bit leaner. Does that make sense to you guys? And why we want to apply this knowledge and not just learn it? So obviously you've got relatively constant loading through your hips. All the weight above our hip is the load in addition to any compression that we're getting through literally the muscles of our hip activating. So when you're walking, we're talking about over 2 times body weight during the support phase. So that's going to be going through the one hip, because remember, you're also lifting that other leg and your torso, your arms, your head. When we're climbing stairs, it's going to be more, and when we're going downstairs, it's going to be even higher because you got that added effect of the deaccelerating your body since you're going downwards. Now, when we're talking about running, now we can easily be over 5 times body weight, even at a relatively low speed. And when we talk about people that are going through massive power movements, like a goalkeeper that's diving laterally, we're starting to get even closer to things like 10 times body weight going through that hip. Now, the harder the sole of the shoes or being barefoot, the greater the loading you're going to have, the softer the shoe because it's going to dissipate force, the less loading you're going to have. And carrying an object in turn is going to add that load to the other side. So as we go faster, we've got greater loading going through. If we have a smoother gait, so we're not so bouncy, but we're able to keep more of that center of, or even center of mass as we're running, that's going to decrease the amount of force. And so the better idea is think land not necessarily heel, but more midfoot contact, specifically with our knee bent, our ankle ready to receive force. So that way we're going to go ahead and be much more easily able to deal with these forces. Now, the hip is meant to put up with very large forces. It's very strong and can endure a lot of loading. But at the same time, with the body, you're looking at what's known as a hermetic stressor, which is where too much of any stress is going to get ourselves into a situation. Now, hermetic stressors are just an important thing to understand when it comes to life in general. So specifically, if we are to go ahead and think of any stressor in your life, hermetic stressors are going to have initial up, and then we go down, 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 and then like death. Okay? So the basic idea is a little bit of stress from where you're at baseline till you're going to hit a point of optimum stress that's going to really help make you go forward. Now, at a certain point, you've done so much stress that really all you've done is made yourself very tired and you're not really moving forward. But if we keep going, that's eventually where we're going to fall apart and potentially risk injury. So when it comes to loading the hips, doing these movements, the equivalent that we could think of here would be effectively, we have 0 sets of squats followed by, say, 5 sets of squats is where we're going to get the maximum return. When we get out to, say, 12 sets of squats, congratulations, you've just worked really hard and you've gone nowhere. But then when we get ourselves all the way out to the whole, I don't know, we'll call it madness and or death, this would be effectively doing like 100 heavy sets of squats on the same day. And yeah, you probably tore something off, broke something. So when you're working with athletes, yourself or anybody else, you're looking to try to find that point of which you're applying enough stress that the body can recover from, that you're going to in turn be able to make the most amount of progress. So it's not about, it's the difference between training optimally, not maximally. Anybody can train themselves into the ground, but you've got to know that point of which where you get the greatest amount of stimulus and you're not doing any detrimental effects on the body. Does that make sense to you guys? So obviously, when we apply too much stress, could be acutely due to obviously something really traumatic like a car accident, or through essentially chronic overuse, we're going to have some type of issues. And the most frequent issue when we talk about fractures, it's going to be referred to sometimes as breaking your hip. When in reality, what you did is you broke your femoral neck. Now, you can also have the intertrochanteric fracture, which is a little less likely, and it's typically to be found in individuals that have osteoporosis, which is normally found in older, smaller women, and that's bones that effectively are too brittle. As we're going to talk more about bone later on in the course, all of your bones are literally adapted to deal with the stress of which you encounter on a daily basis. That's it. So if you never lift heavy, you never do any plyometrics, no impact or anything else, your bones, they don't have to be strong at all. So the body's not going to waste resources and put away this extra calcium that it doesn't need to store. Instead, it's only going to store that which it truly needs. So that way you're going to go ahead and have that quality of life without any type of issues along with it. Now, you can have contusions, and I'm sure a number of you guys have had this before, playing sports, taking a shoulder pad to the thigh or otherwise. You can obviously strain a number of the muscles, specifically the hamstrings, which is going to occur especially when someone is fatigued, and especially more of your high power athletes, the ones that can really get after and go pretty fast. And the problem with these initial strains or really bad sprains of the actual muscle itself is when the body has all of its collagen otherwise is going in a good straight line. So if your musculoskeletal fascia and everything else is lined up like it should be. When you injure yourself, you put down scar tissue, which now starts to make things, instead of pulling in this nice straight line, we're pulling in this shearing factor in a diagonal because of how we're going to possibly scar over and not get ourselves to recover like we should to optimize the function of that tissue. That's why anytime someone has really bad muscle strain, they are going to be that much more likely to having that strain occur again and again and again in that same region of the body. Now, you can also have the same type of issues with the adductors. Remember, they're going to help with keeping the leg underneath us, and they are going to be used a little bit of hip extension. So they can easily have to be subjected to more force than of which they're going to typically be able to tolerate. And that will then bring us to the knee, which dual condyloid articulations between the medial and lateral condyles of the tibia and femur. So we got the tibia, we got the femur, we got the patella in front, and this is going to be mostly a hinge, except for you can also get some lateral and medial rotation. So sitting down right there, guys, think about taking and turning your foot towards and then out if it's your right foot, and you'll feel that rotation when your knees bent, and that's all done by your hamstrings. That's why your hamstrings are really important in making sure that we keep our knee healthy. But I think we've covered enough information for this morning. You guys have been pretty well exposed to the review stuff. You've got your exam, so we are not going to meet up on Thursday morning. Instead, do your best and forget the rest. Any questions, comments, concerns? Anything else you'd like to review for the exam? Anything like that before we call it a day or call it a morning? Oh, I hope it goes well for you too, Luke. Good luck, guys. Do your best. And yeah, I guess if nobody has anything else, stay safe out there, guys. And make sure you guys take it as both the individual for the minimal math, and then you do the group segments together. So good luck, guys. Stay safe out there, and I will see you guys next Tuesday. All right. Bye-bye.